Oh, well, it could be better, sir. I have a question for you.
Go for it.
Between the past 2 to 3 weeks, my brother and I, when we go to sleep at night, it's about the middle of the night,
All right.
and our hands get numb to the point that they're so sore that they wake us up.
Both
now,
you and your brother simultaneously?
You're correct.
Oh, okay.
Now, I'm left-handed and he's left-handed. Well, my thumb on my left hand gets so numb, and like when your hand sleeps and you try and wake it up, and it doesn't do that. Well, he's right-handed, and his thumb is doing the same thing, and we've tried everything, the NAC, the B12, pain medication, and nothing seems to work.
Okay, well, let's back up a little bit. Okay, so you're left-handed, your left thumb hurts. He's right-handed, his right thumb hurts. What we're going to do is we're going to go through a differential diagnosis of what will cause a thumb to hurt. I actually, as a vet when I was with the Navy, they were every month or so, one of the senior attendings would have to do grand rounds. That's where they bring in everybody into one large room, and some expert on something would get up in the front of the room and do a formal presentation that would last 50 minutes. Okay, it was a big deal, teaching hospital, so on and so forth. And being the cocky sort of guy that I am, I would allow them to pick the topic the morning of the grand rounds, and the grand rounds would start at 7:00 in the morning. So at 6:00 they'd tell me the topic. I'd cobble something together, and the bet was to figure out if anybody would know that I had just cobbled it together. And so I did a presentation one time on ear pain. Mm-hmm. Okay, and they didn't think it could be done. Well, the joke is you can do the same thing with thumb pain. There are many, many causes of thumb pain. In one person,
and it's just not just thumb pain, sir, but it's our whole fingers.
Okay, so all 5 fingers, but only on one hand.
Both hands and all the fingers.
Okay, left. Okay, his right and your left, but just the fingers.
Yes,
makes a difference.
The thumbs are the worst, but the fingers. I mean, it's the
piece of
like
cake.
When you have numbness when you sleep, and it's not a sleeping habit.
You're going to do fine.
But
do
the
you
numbness,
sleep?
It turns into pain.
Got it.
It's so bad.
Okay, Laura, do you sleep? My turn.
And I'm just.
Okay, Laura, do you sleep on your left side?
Both sides, sir.
Okay, do you go to sleep on your left or wake up on your left?
It varies.
Okay, does your brother sleep on the right, wake up on the right?
I would say that varies too, sir.
Okay, what I want you to do is to look at this, okay, to look for a pattern, because there are very, very few things that will cause just the digits or just the hands on one side to do that. The most common of which, okay, it is something called golfer's elbow or medial epicondylitis. And when you sleep, the arm can be folded, tucked, or put under pressure. When that happens, it leans up against a branch of the median and ulnar nerves, the cutaneous branches. And so if the arm is flexed at the elbow, okay, and you put pressure on it with your rib cage or just lying flat on your stomach can do it too, okay, then you will end up with numbness in the hand and spasm as well, and it can turn into pain. Now,
correct.
is it? Yeah, it's correct. All right. If you are going to go ahead and have a vascular issue, you could do very much the same thing. It would be called a type of claudication, but you would see changes. You would see that the hand changing color, there would be a hot and cold sensation to it. But when you're dealing with small cutaneous nerves that are put upon as a result of an enthesopathy, okay, and that's which is called an enthesopathy is a disorder of musculotendinous insertion or attachment. In this case, it would be a muscle called the flexor carpi ulnaris, or the FCU. And so when you flex it, lean on it, your hands will go numb. And I'll do this in the office periodically in examining people to try to reproduce this sort of symptom. And all you have to do is drop the elbow into the palm of your hand, and your thumb will rest right over the FCU and the cutaneous branch, medial cutaneous branch of the ulnar nerve. So you give a little tweak. Hands go to tingle, they start to hurt, and you can reproduce this easily enough. What you have to do, the way you can mend this, is by doing two things. One, monitor the way that you're sleeping and try to alter it, which is darn near impossible, okay? But generally, that's all a matter of motivation. The second thing is an anti-inflammatory taken at night. Okay, if you take the anti-inflammatory before you go to bed, okay, it should take care of this. All right, but you also have to be careful not to sleep on your elbow, as if your elbow were tucked under your chest wall, because if you do that, nothing that you do is going to make any difference. If you have difficulty sleeping, you can take something called GABA, G-A-B-A, which is short for gamma-aminobutyric acid, that acts as an anticonvulsant for the rest of your body, and it will, in fact, treat the dysesthesia and pain that you're experiencing in the hand. So, Laura, what your issue is dominant side, golfer's elbow. Big surprise.